This video discusses global health in regards to the significance of nurse migration. I don't know if any of you have worked with nurses from other countries that have been brought in to help ease the nursing crisis, nurses shortage here in the United States. I know a lot of times nurses from the Philippines are brought over because, especially in nursing homes, because of the shortages of staff. But what nurse migration is, it's movement of nurses from one country to another in search of better employment opportunities, higher wages, better working conditions, professional development. It's a significant phenomenon, and it has several implications. To the global workforce, it fills in the gaps in the countries they go to, but it causes gaps in the country that they came from. Economic impact, it can have both implications for both the country sending and the country receiving the nurses. In the sending countries, they have a lack of skilled healthcare workers, which can impact their delivery of care and their economic development. Although we benefit from the influx of skilled nurses, it can face challenges related to integration, workforce planning, and in today's world, immigration issues are going to be huge. So I don't know that this is going to occur as much as it has in the past. Quality of care, it can impact the quality of care in the country that's sending nurses because they don't have enough nurses. And the receiving company, they may benefit from increased staffing levels and have an improved quality of care because they have more nurses. There are ethical considerations. Recruiting and retaining healthcare workers in one country that is wealthier than another, which can cause issues for the sending countries because they don't have as much money to pay. These can not only exacerbate issues in the workforces of both countries, but in the delivery of health care, and it can cause increased disparities in the sending country and undermine efforts to strengthen those healthcare systems. And then policy implication, they had to develop policies and agreements aimed at regulating the movement of healthcare workers, making sure that there's ethical recruiting of folks, and seek to balance the needs of both countries. It's a complex phenomenon. It has implications for healthcare systems, economies, and healthcare workers. I don't know how the change in outlook towards immigration right now is going to affect this, but it has been an issue, so we will continue to discuss it. In the sending country, I'm not going to read everything on the side, but you can imagine it's caused staffing shortages, losses of skilled workers, impacts on training and education, and remittance benefits. There can be financial remittances where one country is paying another country in the communities because they sent the nurses to our country. We send money back to that country. Some nurses are recruited here with the thought to send them to get their master's degrees. There was a whole cohort of master's students that I think were at Xavier. They were getting their RN to BSN and then their master's paid for by a health organization that wanted more master's prepared nurses. And in the receiving country, there's a workforce expansion. There can be a diversity of skills, but integration is a problem with the cultural differences and language barriers. These will need to be addressed. And then dependency on foreign workers. If we can't become dependent on foreign workers, that can lead to challenges in the sustainability, workforce planning, and it can cause an unnatural feel that the shortage is being eased instead of doing more to recruit and retain homegrown nurses like us. some trends and challenges. There's a global demand for nursing. Not just the United States is having a shortage. There's global demand. There's regional imbalances. People want to work where they can, not only in countries that they can pay them more, but in areas that can pay them more. We saw this during COVID when travel nursing shot through the roof because you can make $100 an hour as a bedside nurse if you were a travel nurse and you went to Louisville, more than you could make here in Cincinnati. There needs to be ethical recruitment practices. Just as with anyone, sometimes agencies are recruiting foreign nurses and not being totally true about what their expectations will be in this country. They can exploit people that are coming from low-income countries. And then there's a brain drain impact. Origin countries can lose their highest skilled nurses, their most educated nurses, to wealthier countries, which will impact future healthcare delivery and public health. Regulatory challenges. There are regulations like licensure requirements, language proficiency standards, and other expectations that need to be addressed when a nurse from another country is coming to our country or any home country to be employed. During the COVID-19 pandemic, we saw a highlighting of the importance of nurses and healthcare workers, and that's led to an increased demand in most countries. It's also disrupted migration patterns, and there are challenges for recruitment and deployment of nurses across borders. Destination countries are focusing more on retention strategies to decrease nurse turnover and reliance on foreign trained nurses. Those would include better working conditions, including nurse-patient ratios, career advancement opportunities, and investing in nursing education and training. And then technology such as telehealth and digital health platforms, they're going to change the way healthcare is delivered, and they have potential impact on nurse migration patterns. Health issues faced by migrants. This is not foreign-born nurses. This is people migrating to the United States. And as I said, we're going to have less migrants, but we still have migrants. And when migrants do come to us, we need to take care of them. Migrants have physical health issues. They have a range of issues that they can have, including infectious diseases, non-communicable diseases, and injuries that they may have sustained either when they were working or migrating to this country. Mental health issues, just as in everywhere, there's an increased risk in migration. PTSD, because people coming to our country are usually leaving a bad situation. So they could have PTSD, they could have depression, anxiety. And stress is such a huge factor in migration and trying to become acculturated when they get here and become part of our culture, and the discrimination and trauma that they can experience when they come to our country can contribute to mental illness. Access to health care, there's often barriers and they don't have health insurance, and there are cultural differences in whether it be in their health practices or in their language can impact their care. Migrant women and children have specific health challenges, like inadequate access to maternity and child health care services. There is a higher rate of maternal and infant mortality in migrants, and vaccination and preventative care, if they didn't have an issue to health care, can be an issue. And then nutritional issues such as food insecurity, inadequate access to nutritious foods, and dietary changes as they migrate can all pose health problems. Substance abuse, they may have an increased risk of substance abuse which can negatively impact their physical and mental health, but this can be because of the situations that they are dealing with. They can self-medicate. Injuries and violence against migrants, sexual and reproductive health. They have challenges accessing services including contraception, family planning, and prevention and treatment of sexually transmitted infections. And then social determinants of health. They face social determinants that can impact their well-being. And these can include poverty, lack of access to education and employment, housing and food insecurity, and social isolation. So addressing these issues requires a comprehensive approach that considers the social, economic, and environmental factors that influence their health. Trying to make sure they have access to healthcare services, addressing social determinants of health, and promoting inclusive policies that protects their rights and well-being are needed. Access to healthcare for immigrants will vary depending on the country and the healthcare system, as well as the immigration status of the individual. Here's an overview of some access that I've documented here for you to read on this slide and on the next slide. It depends on what type of immigrant you are, what your situation is, will determine your access to healthcare. The next 4 slides deal with health disparities in immigration, and I know you've discussed healthcare disparities and the impact that these and social determinants of health have. Remember, along with everything, data collection and monitoring, we need to improve data collection and monitoring of health disparities in this immigrant population to better understand the factors influencing their health, to provide targeted intervention. But a lot of times if they receive care, it's very sporadic, and often there's not a good chain of documentation to help deal with them. But the next 2 slides deal with the issues there. And then climate change and global health. Climate change is actually an issue when we look at global health. There is an increased spread of infectious diseases since we've started being aware of changes in the environment. Food and water insecurity occurs. Some places get way too much water. Some places do not get enough water. So there might be shortages because there's not enough food and malnutrition occurs, or if there's a lot of precipitation and the water quality is poor, though, they can get cholera and diarrhea. So it's very much a balance that needs to be maintained. I have on the next slide, I think at least the next 2 slides, effects of problems with the environment on health. These include air pollution, water contamination, food contamination, climate change, and vector-borne diseases. And mental health. Just want to point out as you read these that you've seen a lot more in stores where they have recalls of food, and this has happened a lot more in the past decade than it ever happened before. So just know that issues in our environment, and that goes back to Florence Nightingale, who said environment was one of the key parts of nursing care, having a healthy environment. Now, some strategies for mitigating the impact of climate changes are on these next pages. that you will go through, and basically it's focusing on trying to promote healthy, sustainable lifestyles, education, ensuring access to clean food and water. So just know that migration and our environment have a huge impact on global health. And as we learned during COVID, in our world today, because you can fly to any country, people are constantly moving throughout the world. Global health impacts our health locally and in our country. So that is why it's so important to ensure that we work as a planet to focus on the health care of everyone in the world.